name is Dr. Ashley Beckman, and I'm a doctor of Chinese medicine, but I focus on cellular detox using functional medicine practices, and I combine genetics with Chinese medicine theory to create custom protocols for my clients.
So just to kind of set some context for this conversation for our listeners who might not know, can you explain the difference between the mold spores and the mycotoxins and why the latter is so toxic?
So basically you have mold spores, which can be, quite prevalent in your home, outside, and even kind of in different grains and foods and things like that. But within the mold spore, there's also a mycotoxin, and these are the very toxic substances that make us sick and can create issues for our body and create an inflammatory response, and even, create some very, very difficult side effects and symptoms for us. And that is something that I work on with my clients. A lot of times people are not aware that they have mold exposure, or that some of the chronic health issues and concerns that they have could be impacted by their exposure to these mold toxins or mycotoxins.
So what are some signs and symptoms that might indicate mold exposure?
So the most typical ones that people are aware of would fall along respiratory symptoms. So chronic sinus infections, allergies, and basically just someone who kind of keeps getting sick and they're not really sure why. So a lot of that is focused on congestion and maybe sore throats and things like that. But there are quite a few other side effects and symptoms that people have and from mold exposure. And so some of them that I list and see the most frequently are people that have chronic candida infections. This is especially for women, but chronic candida, chronic SIBO, or gut overgrowth of bacteria. These are signs to me that we need to investigate and look for mold exposure. There's also brain fog is very, very, very pertinent and common. Joint pain, fatigue, reactivation of old latent viruses like Epstein-Barr, HSV, different things that people kind of think are, not connected to mold exposure, right? So the mold can weaken your immune response, allowing these other things that you have to resurface. So most of my clients that come to me for Epstein-Barr, which they see on a lab, we actually look for mold, and that's one of the most common things I see. Other things that people have commonly are chronic UTIs, bedwetting, especially for children, that they have kind of grown out of that, and so it's beyond the age of when they should be doing that. That's a very common one. Or women or men that have to urinate frequently, especially at night. And trying to think what else. There's so many, really. Oh, the big one are hormonal imbalances and thyroid issues. So almost all of my clients that have Hashimoto's, so an autoimmune thyroid condition, have significant mold exposure. And so again, when people have these sort of chronic, mysterious symptoms that are overlapping, it's my job to dig deeper and see if mold exposure could be something that they're dealing with that's actually one of the root cause reasons of why they are sick and having these symptoms.
So when you do investigate that and you find out that mold exposure is the problem, what are some next steps? Like, what are you advising your clients to do?
Sure. So there's a couple things, right? We want to see if it's in their environment, right? If it's in their current home, or if this is something from the past, or maybe their work, or for a lot of times for kids, it's their school. So there's not always things you can do about it right now, but we need to rule out that their home is not contaminated, right? And it's because especially your bedroom and certain rooms where you spend the most time. Because what I find is even within a family, you can have some people that are very sick and some that either handle it okay, or they basically are just not in the room as much, and so they don't get as much exposure. So it seems to happen mostly that the kids and the mom are the most sick and the dad isn't as much, but we also know that women tend to have more chronic illnesses than men. So there are different factors at play, but we need to rule out that the environment is a safe place. And so what I usually suggest, first of all, I always need a really good high quality air filter, and I always suggest Austin Air. I went through this myself, and when I was going through all of the different popular air purifiers, that's what I settled on for many reasons, but that's the only one that I suggest. And I know people have their ones that they love, but I always say, please, if you haven't purchased one, use Austin Air. And basically, we can also, you want to check the home a few ways. So the first thing you could do that's the least expensive, and again, it's not the most comprehensive, but sometimes it's a good place to start, are the mold test plates. The next option too, there's a dust test that I love, that basically you collect dust in different areas and then you send that in to get it evaluated. And then the most comprehensive would be have an inspector come out, and I have the companies that I love. And basically usually that's when I see on labs that I've given to my client that there's quite a bit of mold, and we need to make sure that their home is safe. Because even though I don't say that you can't get better if your home is not, remediated, it's just a much slower process, and everyone is so individual that we need to be doing things like having the air filter and cleaning properly and just doing things to maintain the health of the home, especially if there is possible mold exposure.
So you had mentioned that everyone is so different and everybody is so individual. So can you talk a little bit about how mold exposure might impact chronic illness, whether it's asthma, allergies?
So, I have kind of two different sets of clients, right? You got some that this is very new to them, right? And they have some sort of recent leak or something that's within the last year, maybe or so. And they're not usually quite as sick as those that maybe this is their third or fourth home that had significant mold, or they grew up in, a lot of us grew up in really damp areas and had a basement that always leaked, or we just didn't have the education that we do now or the ability to test. And so there are some people who are very, very sick from their childhood home still. So unless someone has actively done things to try to get the mold out of their body and they had a significant exposure as a child, then that is most likely impacting them still. So that's our first step, is see what's in the body, and then also determine, a lot of my clients are chronically ill and they don't exactly know all the different layers that are there, right, and why they're sick. But a lot of them have autoimmune issues, chronic sinus infections. I can't tell you how many people have had sinus surgery, right, because their sinus infections are resistant to antibiotics. And basically most of them, there's such a high correlation with mold exposure. And so we want to get to the bottom of it, right? I want people to feel better. And especially for me, I love working with families and kids, because a lot of kids are getting a lot of symptoms of anxiety and depression, and they're just kind of too young for that, right? And if their home has mold in it, we want to get that cleaned up so that they can actually prevent a lot of things in their future for their health.
Can you speak a little bit more to the mental health component? Like, how does mold impact the brain?
So there are a lot of studies basically linking mold with a lot of different diseases, but especially with depression and anxiety. So we know that basically the most common way, right, that people are getting the mold in their body is through inhalation, or if they're eating foods that have mold on it. So there's such a huge list of foods that can have mold. So I'm not crazy strict, but I do have a couple things that I ask people to switch. One is peanuts, and to just kind of don't do peanut butter and things like that. Switch to other nuts. They just tend to have the highest concentration. You can still get, anything that's basically a cereal or a nut or berries and fruit. It's very easy to have mold contamination on lots of products. So the two biggest are are peanuts and coffee. And then I would say grains. But again, I don't wipe out the whole grains category for people unless it's just something they really aren't, they're reactive to. But so there are definitely great coffee companies that check for mold. And so I advise people to use, there's only 3 or 4 that I know and like. So I suggest those. But especially, so back to the anxiety and depression, because of the route of the inhalation, right, or the eating the foods, basically there is a huge correlation between the gut and the brain. And so a lot of the things that we do that create issues in the gut, or bacterial overgrowth, fungal overgrowth, mycotoxin overgrowth in the gut, this has a direct effect on our brain and the anxiety and depression. And they also find too that a lot of the clients that have even Alzheimer's, there can be a component, right, with different types of toxins, and mold toxins are one of those.
What should the detox process look like after you've investigated and you found out that mold is what's causing all these problems for you?
So I usually start all my clients with kind of a 3-month intro where we are going to look at mold exposure. We do look at other toxin exposure too, like glyphosate and pesticides and environmental toxins, because a lot of times when the system has certain toxins, it allows others to overgrow too. This happens a lot, right, in that mold world with mold and yeast and fungus and bacteria. It's a very happy environment in there, and they all kind of feed off the same thing, which is generally sugar. And things that break down to sugar. So when we're feeding the mold toxins, we're actually feeding the bacteria and the yeast. And so it's all about creating a happy environment in there that is not overgrown and at the right proportions. We don't want any mold toxins in there, but certain types of yeast and bacteria are good as well. So it's all about the ratios and things like that. But what we want to do is we're going to need to make sure that, of course, the person is eliminating well. So they're going to the bathroom at least once or twice a day, that they sweat. That's really important for releasing toxins as well. And then I basically use certain types of foods and supplements and lifestyle to make sure that those detox and drainage pathways are open. And then I use specific supplements to basically pull out and bind the mold toxins. But we have to prep the body first before we get to that place.
So what role does air purification and clean air play in keeping a healthy and mold-free space, either preventative, during a problem, or after?
So I would say the first thing I did once we found out we had a leak in our home was go buy the Austin Airs, because I didn't have them. And so it's really critical, because for most people, they can't, you're waiting on someone to come check out the home, right? You're waiting for possible remediation if someone can do it, because it can be quite costly. And you might be getting, a few quotes or things like that. So to me, getting your air quality in check is one of the most critical things that I suggest first. And basically what goes along with that is cleaning, right? And so there are certain things that we do. It's not bleach. And I always suggest too, the cleaning is more of like the maintenance. You need somebody else who's a professional to come in that's cleaning this up or determining what needs to be cleaned up properly. So because you need to contain the issue if it's there. And a lot of people don't realize this, and this happened for myself, and in my home, there was no visible mold anywhere, right? At least to my eye. And so it's not always something you can see or smell. And so that's a little bit tricky, right? So that's why we need kind of the air filter going. And then you need, ideally it's weekly, but definitely like a deep clean each month to make sure that you're just getting the dust away, because there's the mycotoxins and the mold spores, even though they're around, just because they're there and you don't see them doesn't mean that they're not harmful for you. One thing that happens quite frequently is I get clients that come to me, and some of them have even gotten a mold test, and they are told by their doctor, who really doesn't know much about mold, or is maybe a naturopath that doesn't specialize in mold, but they say that they could help them. They say this is not a big deal. Mold's everywhere. And, this is definitely not causing any of your chronic fatigue or, any of your health issues. So one thing I would say is it's really, really critical to work with someone who actually specializes in mold and mold detox. And then again, have the right people that know how to clean up the home properly. because otherwise you can waste a lot of years and a lot of money trying things that aren't going to work for you, or basically just, again, it's more like wasting the time, because I have so many clients that have been sick for 10 plus years with chronic issues, and their mold tests were dismissed, and they were the ones often that asked for it, and then the doctor got it back and said, well, everybody has mold. I mean, I hear that constantly, and I still say that to patients too, because it's everywhere. We can't escape it, but we need to have the right tools in place to either, clean it up in the home and clean it up in the body, so that we can get the levels down to where it's acceptable for that person, or just our home is its own living entity, and it needs to be healthy for us, not something that we're trying to detox from.
Thanks for tuning in to another episode of Austin on the Air. For more information on air filtration, air quality, and respiratory health, visit austinair.com.